Hello, my name is Dr. John Kennedy. I'm the medical director here in Therapie Fertility. We're an IVF clinic. We've been open since 2021. We're a new clinic in Ireland. And I guess when we started, we came in with the mission that we were going to be accessible, affordable, and evidence-based, and very transparent and honest about what we were doing. We thought that maybe in fertility, certainly in Ireland and in general, a lot of people were being priced out of the market, weren't able to afford care, and there were a whole pile of couples or women who wanted to do fertility preservation or fertility treatment and couldn't access it because of cost. I think a lot of market research would say that's not the case, and I think that's one of the problems with the market research in this area, is that people are understandably reluctant to say, I'm not going for fertility treatment because I can't afford it. Nobody really wants to admit that, but it's definitely a huge factor that determines whether or not people avail and access these services. So we wanted to make it affordable. We wanted to make it accessible. We also felt that in the last number of years, fertility is complicated. It's a quagmire. There hasn't been as much hewing to the evidence as there should be in this field, I think. There are lots of excellent centres that practice proper evidence-based care, but equally there are an awful lot of centres which apply and action add-ons and treatments and tests that perhaps don't have any material value increasing a woman or a couple's chance of achieving a live birth with fertility treatment. And unfortunately, a lot of the time, there's a commercial sensitivity around these. An awful lot of fertility care around the world, and indeed in Ireland, is privately based. This is private healthcare. So there's a commercial pressure for clinics to perhaps offer these tests. There's patients who want these tests. So an axis develops whereby a clinic winds up doing a bunch of tests and treatments that maybe they don't necessarily believe in as well as they should, that maybe the evidence isn't there for. So we adopted the line at the start, but we weren't saying we're the smartest people in the room. We were going to cleave to the best available evidence, the international guidance, the guidance from Europe, from ESHRE, the guidance from America, from ASRM, the guidance from the UK, the HFEA, anywhere else we could get it, taking a look at what we think the best people in the field think the evidence points to. And if something doesn't have evidence behind it and doesn't increase a couple's chance of achieving success, then we don't offer it. So there's a whole pile of things that we don't do here that are traditionally offered in other clinics, some around reproductive immunology testing and things like that. And we're very proud of that. And it's a conversation we have an awful lot with patients who are perhaps asking for these tests as to why we don't offer them, what we do and what we don't do. We decided when we opened that we were going to be somewhat limited in our scope as well, potentially, compared to other organizations, that we were going to offer testing and then we were going to offer treatments. The treatments we were going to offer would be intrauterine insemination, IVF, ICSI, reciprocal IVF, and fertility preservation with egg freezing and sperm freezing. And that would be it. Very specifically, things that we don't do are egg donation and pre-implantation genetic testing. Do we think these things are of value? Absolutely they are. It's painfully obvious that an awful lot of people get benefit from PGTA and will require egg donation. However, these are incredibly specialized areas and I think require specialized focus. What we decided here was the tighter we keep our focus, the more brilliant we can be at delivering within that framework. And so if we have a patient who would get benefit from PGTA or who would get benefit from egg donation as a result of looking at their history and their results and things like that, then we recommend that they travel elsewhere for that. We don't tell people where to go. We don't have any skin in the game, but we give them a steer on some of the questions to ask around a genetic screening program, some of the questions to ask around an egg donation program to help these and support these patients in determining the right clinic for them to attend for this care. But to be fair, most patients don't need PGTA. Most patients don't need egg donation. And if you go to a clinic that specializes in PGTA, you're as likely to be told that might be of benefit for you, and maybe the advantage isn't quite there. So we think that we can cater for the majority of patients incredibly capably here. And for those edge cases that need something else, we're more than happy to give them advice on that. So we're coming up on year 5. We opened in 2021. And it's gone from strength to strength. We've got really busy. We've jumped in numbers. We've accelerated enormously. We're lucky to have just a phenomenal team. I'll talk a bit more about that. And the patients' feedback we get is very positive in terms of reviews, in terms of feedback we get. It's working. The success rates we're very open and transparent about, and we publish those. We publish them using the same criteria the HFEA use. So again, we try to be really transparent about that, because at the end of the day, it's success and service that drives a clinic. Giving proper patient-centered care, giving proper support to it, but also equally, if not more importantly, getting good success. Fertility treatment doesn't always work. We all know this. Giving people a good experience and sharing that journey with them in terms of them knowing that they've done everything they can and should do to achieve success is incredibly important. We are measured on our failures as much as we are on our successes. So with respect specifically to patient-centered care and what I do and what we do as an organization, I mean, I don't quite know how to articulate this. I love my job. I love my job more than anybody else I know doing a job. I'm absolutely blessed in that regard. And if you were to try to break down what I love about my job, I'm competitive, always have been. I like winning. I like getting success. I really like achieving success. And I like being efficient, and I like being organized, and I like being process-driven. But if you strip all that away and you really get down to the meat of what I really like seeing patients. I like interacting with patients. I love sharing their journeys, their stories. I always have. Fascinated by them. And I've been doing this gig for some years now, and I haven't got bored of that. I've never got bored of that. So whenever I find the job is getting stressful, as it does from time to time, what I always wind up going back to is just seeing patients and talking to them and talking through their options and talking through their histories and seeing the ups and downs and the vagaries. It kind of centers me, and it's such a core part of who I am. So when we talk about patient-centered care, part of it is, well, what other kind of care is there? Of course, there needs to be processes, and of course, there needs to be focus on success and achieving that. But that kind of happens in the background. That happens in meetings and coordination between the various different silos and pillars of the clinic, the embryologists, the healthcare assistants, the nurses, the doctors, everybody. But that happens away. Like, the patient doesn't need to know about all the minutiae that control and coordinate whether or not an embryo transfer is going to be successful or not. They need to be directed and helped with their care. But patient-centered care just needs to acknowledge that fertility treatment is one of the toughest things a couple or women will ever do, ever. That it's incredibly hard, that sometimes there are tears in the office, sometimes there are tears in the end. There's pretty much always tears out in the car afterwards. That's a feature of fertility treatment, that people hold it together. Nobody in their right mind wants to walk through the door of a fertility clinic. It takes incredible bravery and motivation, financial, physical, and psychological resources to go through this. So of course we have to acknowledge that. Of course that we have to acknowledge that it's maybe a Tuesday and there's 10 transfers to be done and you got to get through the list. This is one of the most important days of that person's life, easily, by some margin. So being present and being there and acknowledging the importance of these steps and understanding the privilege and responsibility that come with patients having come to you and your organization for treatment is vital. So why is patient-centered care important to us? Because it's everything. Because it is what we do. It's who we are. It's why patients come here. Success breeds success. But most people that I ask, why have you come to Therapy Fertility? They've seen reviews or they spoke to somebody who had a positive experience. And by a positive experience, I don't necessarily mean a live birth, but I mean a positive experience in terms of feeling that they were respected, listened to, communicated well with, and supported with compassion, with kindness. So when we sought this certification, this qualification, I would like to think that we were in a position where we were doing these things already, and it helps acknowledge the huge efforts the team make in providing that level of patient-centered care. So it's nice to have an external validation of what we think we're doing already. So yeah, critical. So there's a certain amount of ego in this. When you go in for these certifications, you think, we're going to crush this. We got this. We're brilliant. And I think when you go through these processes and you go through the extensive questionnaire, and it was extensive for the certification process, it does force you to reassess and just take that opportunity to look at your process, to look at where you're doing things well, to look at where things can slip, because things will slip, can and will slip over time. So anytime you have to put this level of work in, it's always going to not necessarily reveal shortcomings or surprises. I'm very happy and comfortable with the processes, but the adherence to those processes, remembering the little steps and the checks and the balances. Hey, would it be better if we did this? What feedback are we getting on that? So certainly with regard to when we answer the questions, like the supports that happen during and after a fertility treatment cycle is something we're always looking at. Specifically, I think one of the challenges we have in fertility clinics, and a circle I've never quite managed to square, has been when and how to bring in therapeutic counselling. If you bring it in too early, and I've seen centres where they require therapeutic counselling before fertility treatment is undertaken, and in a lot of cases that just breeds resentment. Patients feel like they're being labelled, like they're not able to cope, or something like that. But equally, counsellors will tell us quite rightly that by the time they see most patients, they're in crisis. And there has to be middle ground that we can explore. But how do you offer counselling? How do you support people in counselling so they access it in a timely fashion, that they can build the resources, they can build the resilience that they need into the system to help them cope with the vagaries of ongoing treatment? That's something that's challenging. I think it's individualized, but I think it's something that it's easy to slip on. If you're me and you want to win, and it's very mechanistic, and you're in here to get a baby and all the rest, it's the temptation is just to fall into, we're going to crush it, we're going to just head down, not worry about our feelings, we're going to do treatment. So that constant reminder, hang on, look, none of us know when really we'll tend to be terrible at working it when we've run out of rope. So taking that pause, taking that beat, not for extended periods of time, but putting in supports in place, putting in counselling, putting in additional other holistic supports to help people get through the journey is really important. And whenever we engage in activities or reviews like this, it's one of the things that always gets thrown up is, okay, we need to make sure we're deeply focused in on that, because our natural bias might be to skew away from it, which I don't think is helpful. So yeah, absolutely useful in kind of reminding us of where we want to be excellent. I'm not sure. Is that the right answer? First and foremost, I'm incredibly lucky. To a person, the team we have here, and this has been fed back so many times, are kind. There is not an unkind person in this clinic. And I'm not sure if you can teach that. I've worked, obviously, for many years in many different centres and hospitals, and I have met unkind people. I don't think they mean to be unkind. I don't think they mean to be malicious, but some people I've met have lacked the compassion that I think is an absolutely vital part of doing this job, or being in this role, or being in the organizations like these. So I don't know if you can teach kindness, but fortunately we're in a situation where we don't have to. Everybody we brought on board has had that, and it has absolutely fostered that culture in here. With respect to how do I ensure it, I try to lead by example. I work hard, probably too hard, some would say, but being willing to go the extra mile for a patient. And that means sending a message, picking up the phone, seeing somebody out in a waiting room who's a bit distressed, and taking a minute out of your day to bring them into your office and have a chat with them, and just kind of trying to reset things. And everybody being willing to do that, everybody being willing to demonstrate an empathy and awareness of the patient's needs and struggles is really important. And for me personally, how do you ensure it? I mean, look at things. You go for certifications like this. You put formalized structures in place. You look at NPS scores. You reach out to your patients and you ask them to fill out questionnaires. There's a whole lot of really solid work you can do to try to catch if you're slipping in any area. And you should do that. And I think that's really important. So we look at NPS scores, we get patient feedback an awful lot, we send out questionnaires randomly to patients to try to look at the good and the bad. You learn a hell of a lot more from the bad than you do the good. It's all fun and games when it's brilliant. And then on the ground, personally, you try to lead by example. You try to behave in a fashion with patients as you want everybody else in the organization. I think that's one of my roles. If I'm not willing to go the extra mile, then I certainly can't expect my embryologists, the nurses, the midwives, the HCAs, and the patient coordinators to do it either. But if you are willing to go the extra mile and people can see you putting in that work, then you are entirely justified expecting the same from them. This is, as I said, the best job in the world. We are privileged to work here. The satisfaction we get from working with patients and working in this organization is second to none. So that's a blessing. We should celebrate it all the time. So where do we go from here? Obviously, build on what you have. Don't get complacent. Don't rest on your laurels. Keep assessing, keep learning, keep challenging your assumptions. I think the new technologies come on stream all the time, and I think they present an opportunity to enhance patient-centered care. And I think perhaps they also represent a threat to patient-centered care. And I think you need to be careful about this. So we're constantly looking at accessibility. We had a case recently where somebody was struggling with the written consent. So what we've done now is we've got an audio file of all our consent process. We already had videos for the consent process, but the written consents that we would issue, people can now listen to. And again, just how do people learn? How do people absorb knowledge is different for everybody. So you need to have options for those individuals who might struggle over here, but perfectly able to retain information if it's given to them in a different way. So that's really, really important. I think communication is absolutely critical. We use a patient portal and phone calls and video consults and in-person consults, but the patient portal is incredibly important because it allows patients to feedback to the coordination, nursing and medical team and get feedback on the embryologist as well, and get feedback back and forth. We're answering and receiving hundreds of messages every day from patients. That's brilliant. There's a temptation to let AI take the reins on that. And I think that's a double-edged sword. And I might be wrong. Plenty of people who work in tech will tell me I'm wrong, but I haven't got to a situation where I am comfortable that an LLM can do the same job as somebody who cares. And I know there's a temptation to do that because it can be efficient. So that's something you kind of look at and go, wow, this would make feedback to patients much faster, but faster ain't necessarily better. So you have to look at new technologies which increase efficiency, which is good for patients. It's really good for patients, but you don't want to lose the compassion and you don't want to lose the decency and the kindness that should be the cornerstone of what you're doing. So would I recommend this for other clinics? Of course I would. Yeah, that's a no-brainer. You should always be looking at how you can improve your organization. This is an external agency that is going to force you to self-assess and in turn is going to assess you and is going to point out the areas that you're wanting and the areas that you can improve on. You might are brilliant as you think, or you maybe not as brilliant as you should. And there are always ways for improvement. Always. So accessing resources and organizations that will help you improve, undoubtedly a good thing. I suppose every clinic is different. And I've worked in clinics which I felt have just been absolutely brilliant. And I've seen clinics where maybe I would say that's less so. If you're thinking about applying for this, either your team are on board with it, in which case, great, represents great opportunity, or your team aren't on board with it, or certain aspects of your team, maybe some areas of the team wouldn't be on board with it. And that's also great because that tells you they need to get on board. And how do you affect change? And you do it slowly, and you do it systematically, and you do it with buy-in. You need to get people on board, otherwise change won't stick. But if you are in an organization which doesn't want to do this, then you really need it. You really need it. If you're saying, oh, look, we want to look at this patient-centered care, It's a pile of nonsense. That's nothing. We're brilliant already. You've already gone wrong. So embracing this, embracing the suck, going through the process, answering the questions, challenging your assumptions, challenging your process, seeing where you're not reliant on good people going the extra mile, where they're being helped and supported to provide patient-centered care, is absolutely vital. So it's a good thing to do regardless of who you are. And once you start doing it, you're going to find that you're going to keep it up. You're going to continue doing it because it's going to make you better, and you're going to acknowledge that's what got you there in the first place.